Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Hello friends, if you were asked what is the nerve supply of meninges? Meninges nerve supply. So if you see meninges nerve supply, the meninges nerve supply is by cranial nerve 5, 10 and 12 and spinal nerve C2 and C3. Cranial nerve 5, 10 and 12 and spinal nerve C2, C3 will form the meninges nerve supply. So I will draw a picture. So this is the cranial fossa. So what is this? This is the cranial fossa. Okay, this is the foramen magnum. This is the sella turcica. Okay, this is the greater ring of sphenoid, and here we have petrous temporal bone. Now, from the ethmoidal foramina, there comes ethmoidal nerves which will supply the anterior cranial fossa. Then meningeal branches will be there. Meningeal branches from the maxillary nerve and meningeal branches from the mandibular nerve. So this is V3 and V2. Okay, meningeal branches will give branches to the middle cranial fossa and also to the anterior cranial fossa. Then if you see the posterior, in the posterior cranial fossa, it is by C3 and C2, and also from hypoglossal nerve C2, C3 from hypoglossal nerve, and also C2 from vagus nerve, and then from V1 it goes to the posterior cranial fossa, that is recurrent branch of the ophthalmic nerve. What is this recurrent branch of ophthalmic nerve? This is actually tentoral nerve, which is recurrent branch of the ophthalmic nerve to the posterior cranial fossa. So anterior cranial fossa, the nerve supply is by ethmoidal nerve, and it is from the maxillary nerve and the mandibular nerve meningeal branches. Then posterior middle cranial fossa is by mandibular and mandibular nerve and maxillary nerve meningeal branches, whereas posterior cranial fossa, it is supplied by C2, C3, C2 from the vagus, C2, C3 from hypoglossal nerve, and also a recurrent branch of ophthalmic nerve, that is tentoral nerve. So this is the nerve supply of the cranial fossa. Thank you for watching.
thank you and thank you for watching.